Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to answer the question, how long do you have to recover your knee range of motion after surgery? So this question is a little bit debated. You might get some different answers from who you ask, what surgeons, what physical therapists, patients, or people who have gone through knee replacement surgery. The important thing to remember is there's a little bit of nuance to this answer. So the first 6 to 8 weeks after your knee replacement surgery is the ideal window of opportunity. What I mean by this is your body has not necessarily moved where it's laying down scar tissue too much. Your muscles are relatively loose. Things are able to be manipulated and changed and improved. And this is really when you want to push, for lack of a better term, your knee range of motion. So doing a lot of exercises, doing a lot of bending, doing a lot of straightening, repetitions, multiple times per day, doing prolonged stretches or prolonged holds, either in a extended or a flexed position, and really trying to improve your knee range of motion as much as you possibly can. And so to preface that, you do have that early phase after surgery, so maybe that first week or two where the big thing is managing that swelling, managing that inflammation. And so you might not be as aggressive, but as your inflammation and pain and swelling is under control and tolerable, then you really want to use those first weeks to really push and try to get as much range of motion as possible. You don't have to crank on the knee super intense every time, but you want to do a lot of repetitions, a lot of time in those prolonged stretch positions to improve your range of motion. Now, does this mean that after 8 weeks you can't improve your range of motion anymore? Absolutely not. That's silly. Just what's happening now is your knee is going into that next phase of healing and recovery. So what that means, among many other things, is your body is starting to lay down and align scar tissue, and the soft tissue is going to be less mobile, less able to move and change. And so an improvement that may take so much effort early on in that first week after surgery, now when you're 3 months out from surgery or you're 6 months out from surgery, it's going to take quite a bit more time, effort, repetitions, patience to see those small improvements the further out you are from surgery. So there is that window of opportunity, those first 8 weeks. I absolutely agree with that and think that that's the most optimal time and the most important time to try to get as much range of motion as you can. And it's give or take a week, 9 weeks, 10 weeks, you still can get a lot of improvements. After that, you absolutely can still get improvements. You can get improvements 2 years out from surgery. You can get improvements 3 years, 5 years out from surgery, but it's going to take a lot longer. It's going to take a lot of patience. It's going to take a lot of consistency with doing repetitions of bending and straightening exercises and activities, and it's going to take a lot of time in that prolonged stretch position, and the improvements are going to be much more gradual. They're going to be much more minimal. So don't be discouraged if you're further out from surgery, but just understand that it's going to take a longer time to see those improvements, so you have to be patient and you have to remain consistent. Those are the big things. Thank you very much for watching, and please be sure to subscribe, turn on those notifications so you can catch all of our videos related to knee replacement surgery, the surgery itself, knee replacement, prosthetics, exercises, frequently asked questions, life after knee replacement, everything else in between. Thank you very much for watching.